My name's Kendra, and I have 3 kids with type 1 who are now 20, 18, and 12. And they were each diagnosed respectively at 5, 8, and 4. And so we have had lots of years under our belt together. And diabetes burnout is a really real thing, and it can hit different ages in different ways. I think it shows up in different ways, and also is kind of more likely to show up in certain stages. But it's an important thing to talk about for caregivers, and it's an important thing for me as a parent to understand how best to support kids who are facing and feeling burnout. I think that's a really important role that we can play. Dr. Duke, I wondered if you could share, because it was really, it really resonated with me in our prep for this call about diabetes burnout as, and I'm not sure it's an official diagnosis, but as something different than depression or different, and why that can be important in some cases.
Yeah, what a diagnosis, or what this construct of diabetes distress is separate it from depression, because depression is cognitive behavioral therapy that addresses depression. But these individuals aren't experiencing classic depression. They're experiencing symptoms of depression because of the unrelenting burden of managing type 1 diabetes. So this construct has value in that it identifies a pathway. It gives providers a pathway to help, and that's changing an individual's relationship with diabetes. So that's, I think there's some value in that. I think I originally didn't like this whole construct because we could have distress around everything. We could have marital distress, and I'm struggling in school distress, and it's really situational depression. But I've come to understand and appreciate the value of it, and it guides intervention. So I'm not sure, Kendra, if that's exactly what you asked.
Yeah, that was really helpful for me to hear you talk about sort of even your own evolution in thinking about it, and how distinguishing diabetes distress can lead to different interventions or tools than treating it as depression may. And again, as you said, for some individuals, they may have diabetes distress and more typical depressions. They would need different pathways. But that was really helpful, and I think important to hear.
And diabetes burnout, my colleagues argue about this. It's not clearly defined. There's overlap in all of these constructs. The burnout literature is mostly from business. It's that sense of apathy and giving up, and I'm just sick and tired of this, and I'm going to stop trying piece. That's burnout over time and repetition. Diabetes distress is similar in that it's more the struggle with managing diabetes and the distress that calls. So they're very similar. And my colleagues argue, oh, they're different. And some people argue that diabetes distress burnout is part of diabetes distress. I don't think today we need to differentiate the difference, because I think how we address them is the same. And that might be worth throwing this out. I'll talk about a fundamental piece of addressing that as individuals who may have type 1 diabetes, or as parents to help your child sort of become inoculated against and do much better. For kids with diabetes, this construct of diabetes distress originated because they scored higher on measures of depression. But when researchers, Bill Polanski and, I just blanked, and another researcher, I just blanked on his name, they started looking at this, they found that actual rates of depression were not higher in kids with diabetes, but they scored higher on measures. So they thought, well, what's going on here? And they looked at it, and it's really the burden of managing diabetes, at least to these lower levels of depression. As you guys may be well aware, we're in the midst of a national mental health crisis that's sort of exacerbated by COVID. So much higher rates of depression and anxiety and everything else. This isn't related to our conversation, but I can't help myself. I'm kind of geeky this way, and I love what I do. But part of the reason for increased rates of anxiety and depression is thought to be access to media, all kinds of media. Our brains are designed to know what's going on in our village. You know, historically, throughout time, we've lived in small villages. We don't communicate well across large distances and across thousands of people even. And we're hearing news in New York, and we're hearing news all over the world that's threatening. So we're designed as human beings to respond to that threat. We learn to protect ourselves immediately, and it's hard to unlearn that. So that's thought to be the reason why we have these increased rates of depression and anxiety. So for you guys with younger kids, I recommend restricting access to news and media and learning all those things. I think it's going to help. This can take a lot of forms. It's our relationship with diabetes. Work with a lot of younger kids, maybe a year after diagnoses, and I hate this, and it's terrible, and I try to help them change their relationship with diabetes. That it can be a positive in your life. You can be a role model. You can help others. You can join an organization and advocate for change. There's a lot of ways we can take this thing life's dealt us and do better things with it. So that different relationship with diabetes, seeing it as a positive, and again, it's not one thing, it's a lot of different things, can really help in terms of better diabetes self-care and in terms of preventing these things we call diabetes burnout or diabetes distress.
Well, the first thing I'll say is there's a really, really common dynamic that I see play out where parents, kids, but I would say maybe especially parents are really, really traumatized when their kids are diagnosed. Maybe not if it's your third kid, but certainly when it first happens, oftentimes it starts in the hospital, and not uncommonly it starts in the ICU. It's a terrifying experience, and it's also overwhelming. It involves a lot of lifestyle changes, all the stuff that you already know. But as a parent, you're going to carry around a lot of anxiety, understandably, and kids feel that as well. So oftentimes, especially for teenagers, that dynamic will start to feel a little stressful and can create a sense of distance between you and your kid. A lot of times kids kind of feel like, well, they have a lot of feelings about it, but but they feel like everybody just sees them as having diabetes and nothing else. And so all the topics start to swirl around diabetes because parents start to feel more and more anxious. So anyways, I have a lot of empathy for every parent going through that. I think that's extremely difficult. One point I think is super important is that it gets better. It's really clear, and we have a lot of data to show that the worst diabetes years are the teen years. And they very, very often turn around. So even kids who have fairly high A1Cs when they're a teenager, oftentimes will start gaining better glucose control as they move into their 20s. I usually have a really great graph that I can show you that has that data, which I don't have at my fingertips right now, but it's a really well described thing. And I guess the reason that I made those 2 points is that one of my biggest goals as a provider, and I often tell families that this is probably even bigger than my goal of controlling blood sugars, is to try to is to try to foster or encourage like a healthy emotional relationship with diabetes. It's a very overwhelming disease in families. It can really create some tension, and all of those things do lead to burnout. So I think more important than the actual blood sugar right now is like how is she doing emotionally? Um, what are those feelings that need to be validated? Like I wish that I could take diabetes and tie an anchor to it and throw it in the middle of the ocean, or I wish I could, blow it up or shoot it into space, or I just want to be done with it. I don't want to have diabetes. Validating that, I think, is a big first step, and really fostering a connection over like, this is not fun. It's okay. It's okay to validate those feelings. And then oftentimes once those feelings are really acknowledged, it does give you a little more of a path forward in terms of, okay, we still got to do what we need to do, even if it's not perfect. Obviously controlling blood sugars is a way of staying safe too. So I have other thoughts, but those are my first ones.
Kim raised her hand, so she may have some input on this.
Yeah, I'm a type 1, 31 years now. My daughter was diagnosed 2 years ago. So she's 13. So she's diagnosed right in that tween stage of hormones. She tends to not love to have it be super known that she's diabetic. She likes to keep that very tight-lipped amongst her teachers and friends alike. But I have found in my own personal experience from years and decades of school, trying to get them to be as confident in themselves as possible. And can be really difficult, especially at the beginning, because they do feel different. It's just one of those things that they're going to have to do everything a little bit different to just normal everyday things. They want to go out to play. What's your number first? What's PE going to be? What is the sport you're going to do? So it's an extra thing that us type 1s will always have to think about. But I've found helping her be as confident in herself as possible, which is hard, especially for the teens in the early few years of when they're first getting diagnosed and getting used to it, is the best way, because then when kids inevitably will say something about them being different or something like that, they'll have the confidence in themselves that it's all okay and to try to push through. But it is really hard. 30 years ago it was hard being quote unquote different, having to being a little bit different. I try, knowing myself what it was like, to give my daughter the most normalness as she can. So if her alarm goes off in the middle of the night, I don't wake her up to test her, or I don't wake her up to do most of that. I can do it for her so she gets more sleep instead of me. I was the only diabetic in the family at that time. And so I woke up at 10 when I was low. My mom, of course, woke me up too, but like I had to test my own self, things like that, because I was taught from the very young age in the hospital, when you spent a week learning how to do it back then. I had to do it all myself at that age. And so I've tried to give her the confidence and instilled in her the how-to-ness that she needs in order to be confident in herself and her abilities. It is hard. She has days it sucks. I don't want to be diabetic. And I'm like, yep, it really sucks. But like you said, how can I support you in it? How can we get through it today? And today it sucks, but we're going to move on tomorrow, and you're going to have a better day, and your numbers maybe will flatten out a little bit better, and you won't be all over the place. But it's just hard, and try to give them the confidence. And that's the best piece of advice I can give.
I think the confidence piece is big, but it's tricky. Like how do you give somebody confidence? right? That's a whole topic in itself. But I do think that there's when your child comes to you with a problem, Mom, I don't want to go to PE. I mean, I'm 400 right now. I don't want to go to PE. Um, all of us probably on this call immediately have solutions in our head that we want to give to that kid, right? But one of the best things you can do is there's 4 techniques. One is you can just really attentively listen. Like you're turning toward them, you're looking at them. It invites them to tell you more, right? The other thing you can do is add in, oh yeah, It's a very simple thing. The third thing is another option is just naming what you see. You don't want to go to PE right now because you don't feel good because you're high blood sugar. You are not excited to go to PE. And the fourth thing is you can use imagination, which I can describe in a minute. But what you will find when you do this is that you give them an opportunity to solve the problem themselves. And you would be amazed how often it happens. It's like magic. You feel like they don't have the solution and you need to give it to them. But if you're just very attentive and you just show them that you're listening and that you're there with them with what they're saying, oftentimes they'll come to it. Yeah, gosh, I don't know how I'm going to get my blood sugar down. I mean, if I don't go to PE, it's still going to be high. Maybe I can play for a little bit. I don't know. I'm not saying that that's what would happen, but it might. And even if it doesn't, just giving them that moment and showing them that you have confidence giving them that moment shows them that you have confidence in their ability to problem solve too. Which doesn't mean you don't always jump in at some point, but I think that's just it's a great opportunity to have this a little bit of a bonding, a little bit of just showing them that you know how they feel, and ultimately building confidence too.
So like one of the things that my husband and I needed to keep reminding ourselves especially when our kids were in high school, I'd say like one of the more challenging years when they really, really just want to be done with it, was reminding us that like the first question we should ask is like, how can we support you? How can we help you? Because oftentimes our first question my first thought would be like, you really need to do this. This is really important for you to do this. And it was all, I'm not telling them anything new or anything that they don't already know. So instead reframing it to like, I know, you know, this is important. How can I make this easier for you? Like what, like we're your team, and just reminding all of us of like the team mentality that's required to manage diabetes, and just reminding myself of that role, I guess, as a team player, as a team support. I can't be we're not the primary player in this, they are. And so what do we do to support them? Was somewhat helpful in reframing it, because it's really tough as a parent also you can feel helpless in watching that. And and I think that the thing that I kept reminding myself is I'm not telling them by reminding them of the things they should be doing. We are not telling them anything that they don't already know. And so that's probably not as helpful.
I have a daughter who's about the same age as we're going through the same thing. Her A1C is worse now than when she was like 10 years old. But what I know, she's kind of a contradiction because she's in high school and every experience is new and important, just as an adolescent in high school. But I don't think she doesn't care. I think she does care. I think she cares about her diabetes. I think she wants to be healthy, but I think she's very busy. She's like busy with just being a young woman in high school. And she also, on the other hand, she's also trying to be independent, and she doesn't like it when we ask her about her diabetes anymore. Like, I can't even say, and the worst thing I could possibly say is, did you do insulin for that? Like, because she forgets, like she forgets all the time. And it blows my mind because she's had diabetes since she was 2. But you know what? I'm over that. I've accepted that she forgets that she just ate a bunch of food, like a whole meal, and she didn't do insulin, and it's like half hour later. But I can never ask. Like, it's just, and so it's important. Otherwise, she'll just kind of like get very emotional about it. So what we've kind of started to do, practically speaking, is I will not say, did you do insulin? I'll say, like if we're at a restaurant, I'll go, but what do you think for carbs on this? Like I would probably guess, like I try to make a game out of it. Like I would guess that's probably like 50 carbs, right? Like, what do you think? What did you do? And I know she forgot, she didn't do any insulin, we're sitting there eating, but I'll be like, did you do like 50 or what did you do? And she'll be like, yeah, 50. And then I know she'll like sneak it in the phone a few minutes later. Or when I'm making dinner or something like that, I'll just have the carbs like ready to go. I'll just be like, this is 50 carbs. And then I'll kind of like watch her do the thing, because then I'm not accusing her of forgetting, because that's what she would hate. But I'm just kind of like reminding her in a way that she's not guilty. I'm not saying she forgot. But anyway, that's just a really practical, because I do believe she doesn't want to forget, but she just does, because she's just busy and she's got things going on. I know that there's other things with, that could be happening.
There's a fundamental difference between knowing and doing. So I know I should exercise an hour every day. I'm high functioning, at least I hope I am. I understand these principles, but I have a hard time translating that knowing into doing. So it's different. It's different. There's different principles that shape the knowing than the doing, the knowing. The knowing is necessary, but it's often not sufficient to assure someone engages in behavior. I often see this with physicians. They're not doing what I've asked them to do, therefore they must just not understand. And they tell them again, and they tell them more, and they keep telling them, but it's not really about the knowing. Sometimes it is, but most of the time it's about the doing. And doing is shaped by different principles. We learn based on the outcomes of a behavior. If we do a behavior and good things happen, we're automatically more likely to engage in that behavior, and automatically more likely to prefer that behavior over repetition and time. The clothes you're all wearing tonight, it's likely you wore them before, or they fit right, they were comfortable, and you hung them back in the closet and you just keep wearing them. It's kind of common sense. It's like, well, duh, yeah, I wear them because they're comfortable and I like it. So we learn. I have 25 shirts hanging in my closet upstairs, and I only wear about 6 or 7 of them because those are the preferred ones. They fit just right. I look in the mirror and say, yeah, I look pretty good. So I keep wearing those shirts. They're my preferred shirts, and the behavior of wearing them shapes my preference. The opposite's also true. If we engage in a behavior and bad things happen, we're less likely to engage in that behavior again, and less likely to prefer that behavior. So if we think about diabetes care, every time, and we're getting better, we have CGMs and pumps, but we got to rotate sites, we got to drop insulin, we got to give injections if you're on a basal bolus regimen, we got to dispose of sharps, we got to carry around kits, we got to do some mental arithmetic, we got to stop every time before a meal and do all this stuff. That teaches individuals to not manage their diabetes well. It's just a logical outcome. It's like, well, of course. So that's a piece of diabetes burnout, and it's a piece, I think it's an important piece of diabetes burnout, an important piece of diabetes distress that isn't really highlighted in the literature. It's a well-known behavioral principle, but as psychologists, we're not good at applying our own theories and our own advice to ourselves. So I think it's just missed in the literature. But it's key to improving diabetes care, and it's also key to preventing burnout. And that's understanding these principles, making sure as parents that when your child does what they're supposed to do, good things happen to compensate for the learning that otherwise occurs. That's your praise. That's the language we lose about diabetes. I'm so proud of you. This is difficult. You're doing an awesome job, and you're an amazing son or daughter, whatever, right? So that message associated with diabetes care compensates. And I expect a lot of you are doing a great job on that. But it's important long term because diabetes is unrelenting. It doesn't just stop. It's forever. It's a burden that needs constant compensation for.
Yeah, and Rob, I just want to double click on something you said, because this dynamic about checking to see what your kid has or hasn't done is a real sticky point. So this is where language really matters. If you really think about the words "did you" and you just stop there, you already feel like crap. If someone's asking you "did you," it almost doesn't matter what you say next. It just feels like you're under somebody else's scrutiny, right? And so, I mean, it's a very natural way, and we all do it. And for kids who don't have diabetes, we're asking them, did they clean the room? Did they do the dishes? Did they do this or that? And their teachers are asking them the same kind of questions. Anyways, with the diabetes behaviors, you can always turn it around to like, you can request to help. Can I help you count your carbs, or can I help you, put the insulin into your, your insulin dose or your carb count, and carbs into your pump, or whatever it is. Can I help you draw up your insulin? No, Dad, I already did it. Whatever. Oh, okay, cool. It feels a little different. It's not a different question materially, but it just feels different.
I was going to say the same thing. We did like a variation on Rob's family where I'd say like once our kids were independently bolusing and and you weren't quite sure if they did it or not. I just say, do you guys want help estimating? Like, do you want help estimating carbs, and that whether they had done it or not? And as the years progressed, they kind of picked up on like, that's mom's reminder to us versus like, but it still is a really different way to enter the conversation, which I found helpful. And the other thing I'll just say as a little shout out to the type 1, those with type 1 is like, it feels like it would be hard to forget. And maybe Kelsey can speak to this. Like, it feels for us like it'd be hard to forget. But I think of the things that I should be remembering and I don't. And like, I try to remind myself of that too, because it's really easy from my perspective to like be sort of gobsmacked at certain things when really if we're in their shoes, we might be, right in their position. So.
Yeah, I would say it's definitely easy to forget. I think Kim can probably, attest to that as well. And anyone else who grew up with type 1 or who has had it for a while. And I think it's this interesting transition to where, depending on how old you were when you were diagnosed or how old your kiddo was, at first it's so new that you almost don't know what you're forgetting. It's like you're trying to remember all of these new things and new practices that you have to do every time you want to eat. And so it's so easy to just skip a step on accident. And then you get to the point where you do it every single day, every single meal, so many times a day that you just lose track of what you've remembered to do and what you haven't. So it's definitely, I would say, easier than it sounds. And I'm sure from an outside perspective, sometimes it's like, well, how could you forget that? You know exactly what's going to happen. I catch myself, my husband also has type 1 diabetes, and I catch myself doing it with him. Like, oh, well, why didn't you bolus? You know you're going to go high if you forgot to bolus for dinner. But then, of course, the next night I forget to bolus for dinner. So it comes back and forth. But it's so easy from the outside when you're the one remembering to be like, oh, how could you forget that? But yeah, it's very easy.
Absolutely. When I think about mistakes, I always think about, how a kid can grow through those. And I think the traditional model we have is like, yes, well, you learned you did something wrong. And so you tell yourself, next time I'm going to do it right. And to be honest, that's not very effective. And then there's some other feelings that come with that, like a little bit of guilt, maybe shame, and other things like that. But the truth is, yeah, I mean, I think every kid with diabetes wants to have better blood sugars, and they would rather that they had insulin. They just don't love the process of going through it. Well, I think there's some sneaky things that we can do as parents, that can give them that confidence. And one of the things is to show them that you know that they're capable of doing it. So a lot of times, what we feel is like, how can you not? How could you not remember? And that feels to the kid like, God, they think I'm stupid, and like, something that's like, maybe feels a little bit different is, yeah, I you find something that you really admire about them. Gosh, I just know I see that you are such a capable person, and we all forget sometimes. You've been forgetting a lot lately, and yeah, I know that you're absolutely capable of getting there. What do you think it would take? Yeah. What do you think's getting in the way of, like, not remembering? And then you're opening up a conversation, and you're helping them be the person that that they are, or that they can be, instead of trying to shame them out of disappointing you, right? And just these little bit of tweaks. Kids really do want to meet they want to please you and meet your expectations. And if you show them in a warm way that you have these expectations and you're just wondering why they're not there, that feels a little bit better.
Yeah, I love what you said about just being in it with them. Talking about kind of that balance of letting, especially at that teenage, them have their independence that they want so badly, especially with their diabetes care, but also making sure that they're safe and healthy. And I think sometimes the easiest way to show that is just in those really little moments. Whether it's like the active listening, like Dr. Mustache was talking about, or helping with the really, really simple things. I have friends whose parents would always fill their cartridges for them. They wouldn't do the whole site change, but they would always have the cartridge filled and waiting for them. And it was something that just took, a minute. And it wasn't necessarily what's your blood sugar? Let's correct you. Let's treat. But just an aid, a very small aid that took one step off of the teenager's plate and made it just a little bit easier, and kind of made it feel like we're on the same team, we're doing this together, without it being that push and pull of trying to get them to do something more. I know even just recently, my parents started stocking juice in their fridge. And even now as an adult, that small little bit of not having to think about bringing as much low treatment with me when I go to visit them, and just knowing that it's going to be there, takes just the tiniest bit of mental weight off. So I love that concept of we're in it together, even if it's not in some of those big ways that we're used to when the kids are so little.
There are two things that we look at. One is whether your child's experiencing significant personal distress. In other words, are they maybe doing what they need to do, but it's obvious they're really struggling? And the other is interference in functioning. Are they able to do the things they should be doing? So if there's deficits in either of those two areas, then that's a sign, yeah, you probably should get some help, evaluation, and treatment to help address those things.
And just to answer that other question about how you find a psychologist, Dr. Duke is at OHSU. You could ask your endocrinologist or your pediatrician or your doctor. They at OHSU, there's a team of them, and Dr. Mustache can speak to Kaiser and other ones. But if you ask the doctor, your diabetes doctor, because my daughter did see Dr. Duke when she was like 9 years old, and it was great. It was like he was amazing, and he did a great job. But we got connected right through Dr. Boston, who's her endo and all that. So first place I would ask is your diabetes doctor.
But my question is actually about, so the team that we were talking, like the team support that's necessary and the diabetes burnout, I'm actually thinking about the relationship between my kids. So my son is not diagnosed. He's 3 years older. And, you know, the centering of diabetes has definitely become de rigueur, like in our house. And being proud of my daughter is everything I want to do and help her and encourage her and give her a sense of control. And I can see it doing this split between them. They're not, they haven't always gotten along super great anyway. Like they're 3 years apart, they're different genders, they're into different things, they're developing in different ages. Like I get it. But like they're both fine, they're both smart, happy kids in general. But I'm like, oh my God, like I feel like I'm gonna lose my the focus that my son also deserves. And so I'm wondering about how families have navigated, if anyone is in a similar situation or has gone through that. I'd love to just understand maybe some pro tips on something to try or keep in mind.
Well, I want to have it open to the other parents and for you, Dr. Duke. Well, I just want to note, Ellen and Mike, that we have had some sibling Hope-Mongering sessions before. And so if you go to the YouTube channel, not that it's I think it's great to talk about it now too, but that may be additional help if you wanted to watch some of those recorded sessions that discuss some of those dynamics. But yes, anyone who wants to weigh in on that. I used to be able to talk about this, and then all 3 of our kids were diagnosed. So we no longer had that dynamic in our household anymore, but it was a very valid concern. So I just want to validate that we went and talked to a therapist after our first child was diagnosed for exactly that reason, to make sure that we were kind of attending to the needs of the other kids like we should be, that it is this, shift in focus.
I'll say, just for sake of brevity, that there's a lot of things, but what I often recommend is giving the older child a role in the care and really praise. And, so take him to the visits, give him a role in helping out, make him feel part of helping his sister, putting him in a helping role where he can feel important to his sister. So that'll help the relationships, in that it's sort of one of the fundamentals of psychology. When 2 people aren't getting along, give them a shared goal and they'll learn to cooperate to achieve that goal. So help him be part of the goal of managing her diabetes, whether he has, exaggerate his role, make him feel really important in that. And that will really help him feel part of it. And again, it can be a lot of things. And it sounds like you're doing an amazing job with your daughter. And it is about a balance too, finding things he's doing to give him an equal amount of attention. I mean, and I expect you're doing that as well.
I just want to say one thing that is not that same session we went to that was so miraculous in helping us think about like supporting them to reduce burnout. When our first child was diagnosed, there was another parent who asked a question like this at that time, and this has stuck with me too, is that the psychologist at that time said, well, they said, how do I keep things equal? And they said, well, there's a difference between equal and fair, and doing what's fair is, attending to the need, like meeting each of your kids' needs.
I'll share one last thing, just because I feel like we started out talking a lot about, when we started the burnout conversation, we were talking a lot about validation of feelings. And because I think it's so important, and it's great because it fosters connection. And it also alleviates a lot of the strong feelings, right? Like once they're validated, they can be processed much more easily. I heard a description of validation that it's really stuck with me, and I think it's worth sharing. And that is, I'm a big metaphor person. I always learn well when from a good visual metaphor. So if you picture a park with a lot of benches, and say you label those benches with different feelings, right? Like, so it might be a joy, maybe one for curiosity, maybe one for fear or disappointment, so on and so forth. And imagine your kid sitting down on one of those. And if their feelings aren't validated, it's just a very lonely place to be, right? And sometimes our only responsibility, instead of fixing the problem, our only responsibility is just to sit down on the bench with them. And just that simple act, I really think, I mean, as parents, we feel stuck all the time. We don't know what to do. We all want to be Mary Poppins, right? We all want like the perfect thing to do. But honestly, I found in so many scenarios, it's just that. It's just stopping and just saying what you see and just sitting down. And so if you're feeling stuck, it's okay not to do anything except for just to stop, and to give full attention and just to sit down.